Hey guys, it's Dr. Thomas. I'm up at the CBS Radio headquarters, and we're about to go on with Mark S. Lee. He's a contributor to Crain's, and he also does a show on CBS Radio, so I'm really excited to get on a show, and hopefully I can get some footage of it for you.
This will be the fourth. Okay. So I'm going to do a go out. We'll go out after this. All right, tell me when. Good morning. Welcome back to Small Talk with Mark S. Lee, brought to you by Domino's. I hope you're sitting back and enjoying the conversation with that nice hot cup of coffee, as I always like to say. And the conversation is going to continue this morning with a fabulous young man, Dr. Paul Thomas, and he's obviously an MD. He's board certified in family medicine. From the Wayne State University School of Medicine, graduate in 2013. Oakwood Family Medicine Residency Program, graduate of 2016. He's a graduate of Michigan State University. And really is doing some wonderful things here in Detroit. Now, I wanted Paul to come on because there's been a lot of discussion. There's been a lot of discussion, if you will, about the Affordable Care Act and providing health services to people across the city of Detroit and other things. So I thought the conversation was germane. This is not a political discussion. Let me say that up front. We're not going to get involved in politics. But I want to talk to him about his experience in the area of healthcare. Dr. Thomas, Paul, thank you for joining me. I appreciate it.
Thank you so much for having me on, Mark.
Good. I appreciate your patience as well.
Hey, no problem.
Absolutely. I ran into you. I was at an event with Vice President Biden.
Yeah, that was a beautiful day, beautiful event. Yeah. Great having him in the building where I practice.
And I remember walking in. Now it's all started to connect the dots. As I walked into your room, I didn't realize that was your practice.
Yep, that is my office. It's a kind of a throwback, a one-room office, and folks come to see me in that space down in Corktown, Southwest Detroit area. And we're at 1759 West 21st Street down there in Detroit.
And you own and operate Plum Health, and it's the first direct primary care company in Detroit and Wayne County. And you offer affordable, accessible health care in Detroit and beyond. Talk to us about your company.
Yeah, so it's called Plum Health Direct Primary Care. And like you said, we deliver affordable, accessible health care. And the way we do that is through a membership model for health care. So kids pay $10 a month. Adults under 40 pay $50 a month.
Okay.
Adults over 40 pay $70 a month. And for that, you can call me, you can text me, you can email me anytime. You can come in and see me in my office anytime. And in addition to that, accessibility, availability, I wholesale medications. I get people at-cost labs and at-cost imaging. So let's say, for example, you want to check your cholesterol. Once you turn 35, you should check your cholesterol every year. If you do that at the hospital, it's about $125. I do it for $7.
Wow.
And if you need cholesterol medication like simvastatin, you can buy that for $5, $10 at the pharmacy. I wholesale that for 57 cents.
Okay, that begs the question, though. Why is there such a disparity in prices?
Because you're paying an insurance company to pay your doctor. You're paying the insurance company to pay the pharmacy. You're paying the insurance company to pay the imaging center. I cut out those middlemen. I cut out the billers, coders, lawyers that stand between you and your doctor. And that's me. And I am available and I provide these services at cost. So I don't mark up my pharmaceuticals. I don't mark up my labs. I just do it at cost to save you money. And the only way I make money is if you're really satisfied with my care and you commit to being a member month over month.
That almost sounds too good to be true. I mean, it almost sounds like, okay, wait, is he serious? When you hear that $7 versus over $100, I mean, the average person, myself, I'm not a physician. I don't know how the insurance company works. I don't get into all those intricacies. But I'm thinking, is that real? Is this a scam? And I don't mean scam literally. I mean, just that's how we think. It's like, wait a minute, that seems like there's something wrong with this business model. Either the insurance company's not doing it right or something. That is fascinating.
Yeah, I mean, I get that a lot.
Yeah.
One of those sheets I gave you, it shows House Bill 1033 in the state of Michigan.
Yes.
That was passed in 2014 by Patrick Colbeck to make this practice legal in the state of Michigan. And it's growing rapidly across the country. I'm the second doctor in the state of Michigan to be practicing this model of healthcare, this direct primary care. And Plum Health is the first one in Detroit and Wayne County. So a lot of what I do is educate people. This is a new model. This is a new way of accessing your doctor without the headaches and the hassle of the insurance companies.
That was going to be my question. So So you're a second physician in the state of Michigan,
Yes.
so you're probably the first one in the city of Detroit.
Yes, I am. First in Detroit, first in Wayne County.
So how long before other physicians join you?
Well, I'm at about 50 members right now. I started in my office in January. I've grown to 50 members. People really love the service. Once I get to about 200, I can justify hiring a second doctor. I'd love to hire a female doctor. I'd love to hire somebody from the city of Detroit with some cultural competency so I can grow my business and continue to serve the people in our community.
Yeah, the nice thing is you're first, so therefore you're ahead of the competition, and I put competition in quotes. Now, on the flip side of that, once people will find out about the business model and that you're starting to attract these customers, if you will, patients, somebody else is going to want to jump in and like, okay, I'm not going to let him corner the market. So my question then becomes, at what point do you think other physicians may actually try to come after your business model, what you're currently doing?
Well, I see it as the more doctors doing this, the better. A rising tide helps all ships. And I only need 500 members to be very happy with the service that I provide and the income that I would like to have in the future. And I welcome other doctors to join me in this practice and join me in practicing direct primary care, because we need more primary care doctors in our communities, and we need more primary care doctors in Detroit. In fact, I wrote a recent op-ed in the Detroit News that was published on Sunday, and it talked about the need for direct primary care, the need for primary care doctors in the city. There's only about 50 to 100 primary care doctors. For a city of 680,000 people, that's one doctor for every 6,000 to 12,000 people.
Oh my goodness.
Horribly underserved. If you look at a county like Washtenaw County, where Ann Arbor is, one doctor for every 580-ish people. Oakland County, similar. Now in Wayne County, it's one doctor for every 1,500 people, but in the city of Detroit proper, one for every 6,000 to 12,000.
What did you do before you started Plum Health? And we're talking to Dr. Paul Thomas this morning. He owns and is running Plum Health out of Corktown in southwest Detroit. He's a direct-to-consumer, if you will, primary care physician, doing some great things. What did you do before you started this?
Yeah, so I'm a family medicine doctor, and I did the traditional route, undergrad at Michigan State, medical school at Wayne State, graduated in 2013, and I did my residency over in Oakwood, which is now Beaumont. I graduated in 2016.
So any thought, the reason I asked the question, was there any thought into going the more traditional route in terms of being a physician in a more traditional facility and waiting on customers or patients to come see you?
Right. I was definitely had those offers. I was the chief resident at my program, so I had some job offers from across the city, across the area. And at the end of the day, I didn't want to practice like that. Your doctor, your primary care doctor in the fee-for-service world has 2,500 members, patients. And so they have to see 1% of their practice each day. That's 25 patients a day. They're seeing a patient every 20 minutes.
Wow.
So that means they get 5 to 10 minutes with you. Yeah. And most of the time they're looking at their computer, typing into the electronic medical record. And there's a disconnect there between doctor and patient. It's so rushed. I didn't want to be on that treadmill. I value my patients. I value my family members and friends too much to practice like that. I'm delivering now the type of care that I'd be proud to deliver to my family and friends. If you came to see me at a fee-for-service office, you might wait an hour to see me for 10 minutes, and that's not how I want to practice medicine.
Is there any criteria that a person has to have in order to see you? Because I'm going back on this pricing differential. Will you see anybody, for example, coming off the street or as another referral? What's your source of business?
Well, mostly I market at events to entrepreneurs. A lot of people who control their own costs in terms of their healthcare enjoy this service because I make it very clear what everything will cost. It's a known cost for them. And then as I've gotten more customers, they've started to refer me more and more of their friends and family members. Now, my criteria is that I take care of people without insurance, who are underinsured, and who have insurance. It really doesn't matter. Whatever your coverage type, I can take care of you. Now, I advise you to have some sort of catastrophic coverage in case of a heart attack, stroke, car accident, so that you're covered for the big things.
Any concerns about the uninsured, folks who are not insured coming to you?
No, I take care of about 10 to 12 uninsured folks right now. I understand that I'm the only contact point for their health care, period. Yeah. Now, they still are able to go to the emergency department if something catastrophic happens. But that's why I advise folks to buy a catastrophic coverage package.
Are you affiliated with any hospital?
I am not.
Okay, so you're totally independent.
Yes, I am.
You know, in this day and age, that is so unusual because everybody, I don't care, irrespective of any business, it seems like everybody's affiliated with somebody. You know, in the old days, the hardware store, the neighborhood hardware store has now become a national chain. And so as a physician, same thing. I would think that people would clamor to work with one of the big hospitals or service providers. But you're saying, hey, I have this service. I can offer affordable health care to citizens of the city of Detroit and also beyond Detroit. And there's a huge need in this market for that.
I agree. I completely agree. Yeah, a lot of folks are driven into those larger practices because of the economics of it. It's harder and harder to maintain a private practice that's in the fee-for-service model because of the declining reimbursement from insurance companies and from Medicaid and Medicare. And what I'm doing is I'm saying I don't need to use insurance companies, Medicaid and Medicare to deliver excellent primary care services for folks. If you are able to pay me $10 a month for your children and $50 a month for yourself, I'm more than happy to take care of you.
Are you making money yet?
Not yet, but I'm only in the third month of the business,
That's right.
Hoping to grow as we've been growing. I added 20 members in January, 15 in February, and so far in March we're continuing that trend of adding.
You've gone from 0 to 50. 0 to 50 in 3 months.
Yes, I have.
And that's without even really talking about it. I saw the op-ed in Detroit News,
Yep.
But you really haven't done any mass media conversations or interviews like this, have you?
I've been on social media. I had a nice mention in Crain's when I won the Motor City Match Award.
Oh, good.
I'm a Build Institute graduate. I'm also a Techtown graduate, and I won a pitch competition there. So there's some media about me. People have known my name, and I've been running in the Detroit small business circle for the last 6 months or so.
I've talked to several people who, you're right. I mean, people know who you are. And, I think that you're building a nice niche in this city. And with all the discussion that's happening in Washington, D.C., with respect to this plan versus that plan, and some people saying this is too expensive, and I think people are like confused.
Yeah.
There's a lot of noise out there right now.
Regardless of those changes in the insurance industry and the, national healthcare system, direct primary care is going to remain the same. Either Obamacare or Trump care or beyond, I'm still going to charge $10 and $50 a month.
Well, I tell you what, give us the location where you're working out of again.
Yep, I'm at 1759 West 21st Street in Detroit, Michigan.
And is there a phone number or a website?
Yep, call me on my cell phone, 313-444-5630, or go to our website, www.plumhealthdpc.com.
And what about a social media, Twitter handle?
Facebook.com/plumhealthdpc for direct primary care. And Twitter, I'm at Paul Thomas 2013.
Well, I congratulate you for all the good things you're doing in the healthcare space. We wish you continued success, and this is a very unique business model. I certainly hope it continues to grow and expand across the city of Detroit. Thank you.
Thank you so much, Mark. I really appreciate your time.
My pleasure. There'll be more guests after this commercial break on Small Talk with Mark Ashley, brought to you by Domino's. Wow.
Good stuff.
That's fascinating.